Okay, let's talk about the lumbar plexus. So these are the spinal nerves arising from the levels of T12 to L5, and these will be really important in terms of the sensory innervation and some of the motor innervation around the posterior abdominal wall and the thigh. So if we have a look at this diagram and see what we can see here, we can see an anterior view of the posterior abdominal wall. We have the vertebral column over here, psoas major on either side, quadratus lumborum, and the iliacus muscle. Now, the first nerve that arises from the lumbar plexus will have the spinal root levels of T12, and this will be our subcostal nerve, and this will just be underneath the 12th rib. Then arising from L1, and sometimes contributions from T12, are two nerves. The first one is going to be lateral to the psoas major, and this will be the iliohypogastric nerve. And the next nerve is going to be the ilioinguinal nerve. The ilioinguinal nerve continues over the iliac crest, makes its way through the transverse abdominis muscle and the internal oblique muscle to make its way through the inguinal canal. But what's important about the ilioinguinal nerve is that it does not pass through the deep inguinal ring. Next, we have a nerve coming from L2 to L3, and this passes lateral from the psoas major and descends down underneath the inguinal ligament and terminates at the lateral aspect of the femoral triangle to pick up sensory information from that area. And this is our lateral cutaneous femoral nerve. And in between the muscle fibers of the psoas major on both sides, we have a nerve that comes out and splits into two, and this is our genitofemoral nerve. And the genital branch of the genitofemoral nerve is a motor branch, and this is the nerve that is going to be elicited during the cremasteric reflex. And then the last nerve that's passing lateral to the psoas major, it has spinal root levels of L2 to L4, and this is going to be our femoral nerve. And we know that the femoral nerve is going to innervate the anterior compartment of the thigh. So this is our femoral nerve. And lastly, the only nerve that passes medial to the psoas major is going to be a nerve that's going to innervate the medial compartment of the thigh and go through the obturator canal to reach that muscle compartment. So this over here is the obturator nerve.